Hey, sorry I'm late. All right. Listen, I didn't have anything to eat today. I've been rushing around all day.
It's fast food. That's not healthy.
Yeah, I know. I didn't have any time to get anything else. All right? I don't usually eat this stuff, but I got to eat something. I'm starving. I hate rushing around. All right. The first one we're going to do today, it's how do you get rid of heartburn. And after that, we're going to talk about what a anti-aging doc, functional medicine doc is. That'll be the second show we're going to do. And the third show we're going to do is, these are nasty. The third show we're going to do is, should I be on birth control pills? That one's for women only. All right, just give me a minute here. I got to get this taste out of my mouth. All right, let's go. I'm ready.
In 5, 4, 3, 2.
Right, hold on. Wait a minute. I'm getting heartburn now. Or I'm having a heart attack. Hold on a second. You got any antacids? Zantac?
Here.
All right. Thanks a lot. Those are nasty too. I hate rushing around, you know. It's like life just goes by too fast when you rush around all day, all year. The problem is people eat that way too. They go through, they eat their meal, and before you know it, they're at the end of their meal and they don't even realize what they ate. They didn't enjoy their meal, and at that point they decide, hey, maybe I should slow down a little bit. All right, let's try it one more time.
All right, we got a deadline to keep here, people. Stand by on the set. In 10, 9, 8, 7, 6, 5, 4, 3, 2.
Hi, my name's Dr. Keri Topouzian, and you're watching Ask Dr. T. Today's show is on how to get rid of heartburn. Well, heartburn also has other names. It's sometimes called GERD, reflux, indigestion. And first, let's talk about some of the main causes of indigestion or heartburn. Increased acid production, which is what most people feel are the most common cause. Poor eating habits, like I'm doing today, unfortunately. Decreased acid production and hiatal hernia. Now, I'm just going to mention something really quick about hiatal hernia because, you know, most people have this, and I don't really take this as being one of the main causes, but I just threw this in there anyways. But let's talk about increased acid production. Now, the way people are treated by their physicians usually are with antacids, different medications like Prilosec, Zantac, Nexium, the purple pill, and diet restriction. Okay? Now, there's problems with these different medications because if you read the package insert, it says that you're only supposed to be taking these at a maximum for 8 weeks. Now, I know there's people out there that have been taking these medications for more than 8 weeks, and it's closer to 8 months, maybe it's even 8 years. But there's a reason for why you don't want to be taking these medications for long periods of time. And we've got some of the reasons down here that we're going to if we can focus in down here. One of the main causes, or one of the main problems, is that you need acid to actually absorb calcium from your digestive system. And if you're not absorbing calcium, what's going to happen? Well, you're going to develop osteoporosis. Another problem is that acid will kill all the different bugs, microbes that are trying to infiltrate or get into your system from your stomach. This kills them all off. And third, you need acid to break down protein in your food. And why is that a problem? Well, protein is basically, the building block for all tissues in your body. All right? So let's go to one of the second causes, which are poor eating habits. Okay? And one of the main things I try to tell people is to be mindful of your food. Think about what you're eating. Try to enjoy your meals. Don't eat as a reflex. Eat slowly and experience your meal. Think about what you're eating. Be conscious of your food, okay? And have a love affair with your meal, okay? It's not a quickie. And then decreased acid production. This is the paradigm that we're going to talk about, because this is actually what I find most patients have. Instead of making too much acid, they're actually not making enough. And I'm going to draw a little diagram here to describe this paradigm. Now, if this is your esophagus coming down, and then you've got your stomach, and then your stomach goes off into your small intestine, what normally is supposed to happen is all the acid that's in your stomach is supposed to make everything move quickly in this direction, going through. It increases motility. And, like we discussed before, it kills all the bugs that are trying to grow in this part of your stomach. Now, if you don't have acid, two things happen. Everything shuts down, nothing goes anywhere, things don't move around, and you start getting development of all these different microbes and bugs. They start growing in places where they're not supposed to, okay? So then you eat a meal. The food comes in, and it just sort of sits in this part of your intestine. And these different bugs and microbes, they start to digest that food, and it starts to ferment, okay? And when you get fermentation, you get gas production. All right? And that gas has got to go somewhere. Either it's going to go in this direction, but because you're so close to the stomach, you get this pressure gradient, and it starts pushing this way. And what little acid that you have, that you're making in your stomach, gets pushed up into your esophagus, and you start having indigestion, heartburn. Okay? Then you go to your doctor, they put you on an antacid or one of the medications, and it knocks out what little acid that you're making. The way we treat this, believe it or not, is we actually give patients acid. It's called betaine HCl. And what that acid does is it makes everything move in the right direction, and it kills all these bugs, microbes that are trying to grow. We start out slow. We'll say you take 1 capsule with every meal for the first week, and then we increase to tolerance, meaning until you start developing some heartburn, because then you're taking too much acid, then we drop the dose down a little bit. I would say anywhere from 50 to 70% of the patients that have heartburn will find relief with using this method. So are there any questions out there? There's a question right there. Well, you can email me at askdrt@gmail.com, or you can go to our website at www.cfhll.com. My name's Dr. Keri Topouzian, and you've been watching Ask Dr. T.